This is the recording for care of the patient with chronic conditions safety exam. So as you study for your exam, anything under the safety folder is fair game for this exam. So in today's recording, I will not go over the PowerPoints because we did go over the PowerPoints in class, but I will go over the review that was posted and the IV skills worksheet. And this copy, as you can see, is also available for you in Blackboard if you want to print it and use it for studying. Let's go ahead and start with that. So list at least 4 sites that should be avoided when initiating or inserting a peripheral IV catheter. Hand veins should be avoided on older adults and ambulatory patients. Foot veins should be avoided in adults due to the increased risk of thrombophlebitis. Do not use an infected site due to the risk of exposing the infection to the bloodstream. Do not use a site that has any signs of infiltration or thrombus. Avoid using an extremity with a vascular dialysis graft. Avoid using the same site as a mastectomy. Avoid areas of flexion if possible, that AC. If we can possibly avoid it, we do. Do not use a distal site previous to a venipuncture site. So that's why we start distal and then kind of move our way up proximal, because if we start real proximal on somebody's arm, we lose all that vein that's distal from that insertion site. So we don't start another IV distal to our already started IV site. What are the key assessments? What key assessments should you make when caring for a patient with IV access? How does the use of central venous access devices differ from peripheral IV therapy? So we assess the site for infiltration. So infiltration is when that catheter comes out of the vein and the fluid goes around the space of the vein. So coolness, paleness, swelling. Phlebitis will have heat, arrhythmia, and tenderness, so that warmth and tenderness. Assess the patency of vascular access devices. Assess intake and output. Assess patient for any pain, stinging, discomfort. Assess IV system for proper functioning, infusion rate, etc. Assess and review related lab values and report when necessary. Assess for history of allergies prior to IV administration. So our peripheral catheters, those are inserted by the nurse. So a peripheral catheter are venous access devices that are inserted and remain in the peripheral extremity of the patient. These venous access devices are used for short-term IV therapy such as fluid restoration or short-term antibiotic therapy. Peripheral catheters are usually inserted, monitored, and removed independently by the nurse and are not as invasive as CVADs, or central venous access devices. Peripheral IV therapy runs a lower risk of infection than central venous access devices, but proposes a higher risk of infiltration, phlebitis, and extravasation injuries. On the other hand, central venous access devices are often used for long-term and/or patients who have limited peripheral venous access and are placed in large vessels and empty into a central vein. So going back on that, so our peripheral venous access devices are those short devices that we practice with in lab. We have that short plastic catheter. It's pretty much maintained just by the nurse. And then we have our central venous access devices that are put in a larger vein, and they empty up by the heart into a central vein. Central venous access devices are placed by providers or specially trained nurses. Central venous access devices are more effective when there is need to administer large volumes of fluid, parenteral nutrition, medications, or fluid that are known to irritate veins and cause tissue damage. Radioplaque contrast media. They also provide quick access to the They also provide quick access to the central venous system and reduce the need for multiple venipunctures and decrease the risk of extravasation injuries. Central venous access devices can be used for hemodynamic monitoring and to obtain venous blood samples, which is not usually done through peripheral IV therapy. So we obtain venous blood samples. Like when we were using our mannequin arms and we were like treating it as if it was a PICC line, even though it was just a peripheral line, but we're treating it as if it was a PICC line that went all the way to the central vein. We practiced obtaining venous blood samples. So that's an advantage to a central venous access device. Major disadvantages of central venous access devices is they are an invasive procedure and necessary for placement and increased risk of systemic infection. So our next question is describe 3 different types of central venous access devices. You will need to know this for your exam. So we have centrally inserted catheters, central venous catheter, and on this I do want you to make note that we have a tunneled and a non-tunneled. So if you're on your exam, you see a non-tunneled central venous catheter, you know that that's a central line. Or if you see a tunneled central venous catheter, that's also a central line. So for centrally inserted catheters, the tip of the catheter is in the distal end of the superior vena cava near junction with the right atrium. The other end of the catheter sits through an incision in the chest or abdominal wall. Non-tunneled, usually for short-term use in an acute setting, usually placed in subclavian or intrajugular vein, sometimes the femoral vein. Tunneled, placed surgically for long-term use, placed through the subcutaneous tissue, and a synthetic cuff is used to anchor the catheter in order to provide stability and decrease infection. Does not require a dressing after the wound heals, allowing for easier maintenance at home. Available in single, double, triple, and quad lumens, allowing for simultaneous use. So centrally inserted catheters, we have a tunneled and a non-tunneled. So we have a line, and that's kind of what we were saying we were practicing on. This is our peripherally inserted central catheter. Central venous catheters inserted in a vein in the arm. Basalic vein is preferred because of its larger diameter. Cephalic, medium, cubital, or brachial veins may also be used. I think the S is a typo. Single, double, or triple lumens are available. Used with patients who need vascular access for 1 to 6 months, may be replaced for longer periods. Can be midline PICC or central PICC. Lower rate of infection than central venous catheters. Fewer insertion-related complications. Decreased cost. Associated with higher risk of deep vein thrombosis and phlebitis, usually 7 days after insertion. Cannot use arm with PICC to obtain blood pressure reading or blood draws. And that makes sense. You wouldn't want to put the cuff over that PICC line. Implanted ports consist of surgically implanted central venous catheters connected to a reservoir port. Catheter tip lies in desired vein, and port lies surgically created subcutaneous pocket in the upper arm or chest. Access the port using a special non-coring needle with a deflected tip. Drugs are placed in the reservoirs by direct injection or through the injection of established IV line. Good for long-term therapy, have low risk of infections. Hidden ports offer cosmetic advantages and require less maintenance than central venous access devices. Must monitor access ports for infiltration that may occur if the needle is not placed or dislodged. So let's look at our central lines really quickly again. So we are going to have, well, it says 3 types. but know that your centrally inserted catheters, that this is, let's see, do a different text color. Oh, that's not good. Let's do a different text color than that. Okay, so we have our centrally inserted catheters, and that has two subgroups. You have your non-tunneled and your tunneled. And our next type of central line is our PICC line. And then we have our implanted ports, which is also a type of a central line. So just with all of these, you know that they're longer versus like our peripheral line. So no, these are our different types of central lines. Another thing to take into consideration when we're talking about our central lines is our implanted ports are going to be the only ones that allow for you to shower without it being covered, for the patient to be able to go swimming. Just take that in consideration with implanted ports. Another thing to think about with implanted ports is, okay, so it mentions a specialized needle to administer drugs. So we have our needle. When using that implanted port, you are going to cleanse with alcohol, then use the needle, and for the entirety of the infusion, that site needs to be covered with a transparent dressing.